Unfiltered, uncensored, and unapologetic. This is the Retail Warzone podcast.
Good evening, everyone. Hope everybody's doing well. Give everybody just a second to jump in here. This evening, I have Marissa Baker with us. She is an assistant professor at the University of Washington. And I came across her because of the algorithms on Twitter and whatnot, and a tweet of hers had shown up about this study that they had done with grocery workers and the effectiveness of the different protocols during COVID-19. So what I'm going to do is I'm going to turn it over to her, let her introduce herself and kind of tell us a little bit about what she does, and then we'll get into the meat and potatoes, have your questions ready, and we'll go from there. Marissa, the floor is yours.
Thank you so much for having me. It's been really great to connect over Twitter. Yes, so as mentioned, I'm a faculty member at the University of Washington, and my expertise and my interest is in occupational health. So I study how work impacts our health, whether that's our physical health, like getting injured at work or breathing in something that makes you sick, or your mental health and how, dealing with annoying customers or annoying bosses or having, making enough money, how that can cause stress and depression, and that affects, the health of our workforce. I became interested in occupational health, after I finished my undergrad where I studied biology. I was interested kind of broadly in public health and how to prevent disease instead of treat disease. When I landed at University of Washington, I became interested in occupational health largely because of my upbringing. I grew up in a rural part of Washington state, probably the reddest county on the West Coast. My mom is one of 14 kids and they were all farmers. And it's just I grew up in a very working class community and kind of saw how inequitable work can be. Not only in terms of pay and benefits, but also in terms of things that you encounter in work that could influence your health. And I have a great respect for the trades and the working class. What we have recently started calling essential workers.
Excellent. So kind of highlight some of the things that, apart from this, from your bio on your page for the university. Mm-hmm. I know you did the mental health for the Mariners, and you are part of a community that basically is supporting females in construction, correct?
So I've done work on a variety of other projects in addition to grocery stores. And particularly during COVID. So I've been doing work with U.S. mariners, so folks who transport goods and transport people across the world, but primarily in the United States, looking at their mental health and how the pandemic has impacted that. These are folks that often were, staying on their vessel for 4 months or 6 months without ever being able to leave the vessel because of changes in protocol due to COVID. So you can imagine that's very stressful, especially when only about half of the vessels in the United States fleet have internet, have phone. So it can be a very isolating experience. So did some of that work. I've also been working with EMTs a lot recently, and how they've been impacted, and Uber drivers who were, very impacted very early. Nobody wanted to get into a vehicle with an Uber drivers. But then outside of COVID, as you mentioned, I've also been working with females in construction. Our construction industry in the United States is only about 4% female, and they face a lot of very unique exposures being a female on a construction site, ranging from, PPE that doesn't fit to harassment, discrimination, and things like just can't find a childcare that opens at 4 o'clock in the morning when they have to go to work. Trying to do things to make the experience better for women. in those trades. And then also in the past, I've done a lot of work with welders and folks who work in foundries and looking at some of the exposures in steel. Like, so when they melt their steel, what are they exposed to? And how does that affect their neurologic function? So those are kind of some of the highlights, I guess.
That's some pretty impressive stuff, I'm not going to lie. So kudos to you. So let's talk about this study with the grocery stores. You had a control group, correct?
So kind of, so really what the goal of the study was to try to understand how grocery stores were reacting to COVID-19 very early on. So, very early on, there wasn't really any guidance, and the guidance that we were receiving was changing rapidly. If you'll remember, don't wear masks. Yes, wear masks. Clean every surface. Okay, stop cleaning every surface. And so we were just trying, and there wasn't any like OSHA guidelines. There weren't any, state-specific guidelines. And so what we were really trying to do is look and see, well, what are stores doing? And are stores in different parts of the Northwest doing different things? Are there differences between chains and small, like mom and pop stores? And are there differences based on the income level of the shoppers that they serve? And how does it change over time? So it wasn't so much a control group, but we did kind of have a baseline measure of what was going on in the store. And then we were able to see how it changed over time.
So initially in your study, how do you think, like you said, there weren't really any guidelines and it really was kind of fly by the seat of your pants. How do you think that industry coped on average? Do you think they did a pretty good job, or do you think that they were strapped by costs and, it being kind of polarizing or whatnot?
Yeah, so that's a great question. What I saw that I think was interesting is that most of the grocery stores were responding to make the customer feel safe, and less concern was on making sure that the workers who are working there are feeling safe. And as someone who studies occupational health, my focus is on the worker. And so, there were lots, what we kind of saw was they're putting in things to keep the customers feeling safe by, trying to get the customers to follow, only go down an aisle one certain way, or, having the checkout line clean between every customer, things that probably don't make that much of a difference for an airborne disease, right? And there wasn't, but it didn't seem to be that there was an emphasis on, well, what can we do to protect the workers? So, I feel like where we were in the Pacific Northwest, and our study was in Portland and Seattle, pretty uniformly, all stores required masks, and that aligned with our government orders out here for requiring masks. But, fewer stores had things like, people actually enforcing that people were wearing masks or having masks to hand out to shoppers. And so that can get into that can create a risk for the workers if they are the ones having to tell people you need to put on your mask, or if they then become bouncers enforcing the mask rule. We've seen that has led to violent incidents, and so that's not what we want to see. And there was a lot of focus on cleaning and closing down things like, the soup or the grab and go donuts, or, salad bars completely got closed down and things like that. So, and it was really about protecting the shopper and not the worker who is really getting the brunt of it day in and day out.
Well, I think the way it progressed, now I would say probably you guys, where you were located, fared better. But, I think it was pretty well understood amongst employees that as this thing progressed, they moved further and further away from the safety protocols to keep the customers coming back in, which
Okay.
which was one of the most frightening things, because then it became like, here, where we live, it became a constant, well, the customers, we're not going to enforce the mask thing. They don't have to wear it. Or, they came in deliberately, disobeying. And a lot of these corporations were telling their managers, you can't say anything. It's all about, getting that money. And there again, too, shows kind of a lack of empathy for their worker base, because they're basically selling out their crews, for $1, and
Right.
what, as far as the different types of prevention measures that you guys studied, what did you find actually worked the best?
Yeah. So, I mean, the things that's probably at this point and always the most important is ventilation. And that is something that's really hard to assess. And also it's very expensive to upgrade and make changes to. And so I can understand that it's not something that maybe has widespread attention paid to it. But, increasing the airflow in a space is great for so many things, not only COVID, but other diseases as well. And, also just we've seen links between poor air quality and people feeling lethargic and tired and unmotivated. And so good air quality is really essential for worker health in so many ways. And at grocery stores in particular, you do have doors opening and closing frequently. It's not like, it's typically not stuffy, but it's just probably something that a lot of attention wasn't paid to. A lot of the things that were happening, particularly out here, I would put into the category of hygiene theater. Which is kind of doing things to make people feel safe, whether or not they actually are necessary. So things like cleaning the belt, the checkout belt between every shopper, or out here, there was a lot of telling shoppers they could not bring in reusable bags. And in our state, in Washington State, we do not have plastic bags. And if you opt into paper bags, you have to pay for them. And so for some people, not being able to bring in their bags, like, really ticked them off. And, we have no reason to think that customers bringing in their bags was driving disease. So hygiene theater like that, like having someone clean every single cart, when, again, that is not how the disease is going to spread. It's airborne. It comes out of our mouth. It lingers in the air. So doing things like upgrading your ventilation is going to be the most effective. But I should mention that there are other things that I think are as important for workers in grocery stores. And those are what we call administrative controls. And so these are things that are done to change to change the work environment, but maybe not directly, like not installing a ventilation or having people wear masks. It's more like changing the policies and practices of the work environment. So things like hazard pay, things like increased sick leave, things like more pay in general, things like better benefits, things like being able to get a COVID vaccine before other workers, things like that, work-life balance around, a lot of people might have had kids home because school's closed. So I think things like that are ultimately as important for keeping people safe at work and for, keeping them excited about working and not feeling like it's such a drag.
Well, to your point on that, you got to think that there were a lot of people that were pulling extra shifts and whatnot. And we all know, I mean, as you wear down, your immune system wears down with you. So if you're putting these employees through all these excruciating shifts and hours and lack of breaks and whatnot, that's just as detrimental as anything else. And I think the one point that you made that, in hindsight now, 2 years later, yes, it was airborne. and it was like, you're right, hygiene theater. I mean, it was clean, every doorknob clean. These stores had like a checklist they had to do every hour. That now in hindsight, it was useless.
But at the time, we thought it was really important, right? And so yeah.
I mean, that to me is absolutely crazy. Now, were you guys able to pin down, like in your study, let's say the plexiglass shields in front of the registers, or and the different, like, what other than ventilation did you see the most success in prevention? And then what would you other than the hygiene theater, what would you say was one of the most useless things?
Yeah, so I'll start with the most useless, and it actually probably is those plexiglass screens. And I'll explain why for a couple of reasons. So the size of the virus when you breathe it out, it's equivalent to like the size of particles in cigarette smoke. So think about someone standing behind one of those plexiglass screens, smoking a cigarette and blowing out the cigarette smoke. It's going to go around the screen. It's going to go over it. It's going to go under it. That screen does not contain it. When you have particles that are that small, they move at the whim of the air movement, right? They don't fall to the ground. They don't stick to the plexiglass screens. They're going to find a way around. And so that's kind of the first reason. The second reason that they are not great is because someone who is behind one can start, like, the air, it creates what we call an eddy. So basically it traps the air between the person and the plexiglass screen, and it can actually increase their exposure to whatever is in the air. So those are things those are tricky, because early it seemed like that was helpful when we thought the virus was larger and it fell to the ground. And now it's almost like people expect them to be there. And so if you take them out, people will get mad. But really, they're not necessary, and they're they could be detrimental to health. In terms of, controls that I think are actually important and actually work, masking does work with some caveats, right? Like, you need to have a high quality mask. It needs to be consistently worn. And there needs to be, kind of a community of masking, where everybody is wearing a mask and everyone's wearing a high quality mask. But when we think about masking, like, even if it's a cloth mask or a surgical mask, which isn't as protective, even if it only provides 25% reduction in, cases, that still is a huge impact when it comes to overfilling the hospitals and things. So kind of having to think about masking as it's a public health measure where you might still get sick even if you wear a mask, but you've probably prevented some other people from getting sick. And so overall, our numbers are looking better. So definitely masking and ventilation are kind of the two. And then lastly would be limiting the number of people who are allowed in a space. Just because the more people you have, the more people are breathing out, the more potential virus there is in the air. And so anything you can do to limit the number of people is important.
Well, I can tell,
but not for the bottom line, right?
Right. Because I can tell you from some of the places I went into, they did not care about the number of people. And going back to the masks, I like the point that, when you look at a percentage, and my wife and I were actually discussing this earlier, and I'm like, none of us go in to buy an umbrella expecting it to keep us 100% dry, nor are they marketed as such. Okay. So basically they're there to keep you less wet. And nobody's fussing about that, but they wanted to fuss about a mask, and it's the same principle, and, as a parent, when this thing started, we looked at it like, regardless of what anybody says, and if there is or is not, accurate data, as a parent, if you told me it was like 0.00001% protection, as a parent, that's better than zero. So, you kind of roll with it. But, from the standpoint of the protections put in stores, here in the Southeast, especially at grocery stores, when this thing hit, there was no like door monitor here. You're saying, okay, we can only have X amount of people in the building. Especially when it started getting really, really bad there at the end of March, 1st of April, it was like a zombie apocalypse movie when you go into a grocery store here. It was just like people just going everywhere. And, we all bought into the sanitizer. So let me ask you about that. The hand sanitizer, how effective, if any, was that?
Yeah. For COVID, not very, because again, how the virus spreads. I mean, if you were to get virus on your hands, you probably would not have enough to be able to infect yourself or someone else just by touching with your hands. But in general, hand sanitizer, great for cold, great for flu, great for other diseases that I don't want to minimize. So, we could all probably wash our hands a bit more in general. And that's great for a variety of diseases, just maybe not COVID. So
yeah, because that became a gold mine. It's like if you were able to find a bottle of hand sanitizer, it's like, oh, you could sell that on the market for like quadruple the price.
Yeah.
But so when you were doing these studies, were you or members of your team actually going into these stores, and did you get any kind of pushback for asking questions or whatnot, or was it all pretty copacetic?
Yeah, so we were going into the stores. We had about 9 stores in Seattle and I think 7 in Portland. So I was in Seattle and I had a grad student who was down in Portland. And so we were visiting every store every month for almost a year, which we call a longitudinal study because, we were following them over time. We did not get any pushback in the whole time we were out. We had talked with our research ethics team at the university about what we should do. And, we were told that if someone asks you, you need to be honest and say, we're researchers at the University of Washington, we're collecting this data, but we were not collecting data on any individual people. It was more like, does the store require masks? Not how many workers in the store are wearing masks. And so we weren't collecting individual data. It was all store level data. But none of us ever got approached. I mean, I walked around with an iPad. I wasn't trying to hide it. I wasn't trying to be conspicuous. I think I guess I just didn't stand out. But it's interesting you brought up the limits on numbers because we actually did see that a lot in the Seattle and Portland area, even among major chains like Walmart and Costco. They were very much limiting numbers, and we would have to queue, stand in line sometimes over a half hour just to get in the store. And so that's really interesting that is something that was different here as compared to other parts of the country.
Now, given the fact that you're there in Seattle, am I correct? Wasn't Seattle one of the first big really outbreaks?
Yeah, we were. We were the first case that was found in the United States at a long-term care. I think it was at a long-term care facility just outside Seattle. So we kind of we had some of the first cases very early in even late February, but then very quickly New York kind of overtook us as numbers and spread.
I mean, it was quite frightening to watch this stuff in real time. And, it was, it really was. Now, going through some questions. So with the study and the mental health of the employees, did you find any care from the companies about the added strain, physical and mental health placed on their employees during this?
Yeah, great question. So just to clarify, I never did a mental health assessment of retail workers, which I would love to do. But for some of the other type of work groups that I talked to, I can share some of that. And so for the mariners, very few reported receiving any training or communication related to mental health during the pandemic. Same for the EMTs. Maybe you have like an EAP program, an employee assistance program that you can call if you feel like you really need mental health help. But in general, I just think it's very overlooked. And often there's this attitude of, you should be lucky to even have a job, like you're getting money, you should be grateful, I don't have a lot of examples of workplaces in general who are supportive of worker mental health.
Well, I've got a ton of volunteers here in the chat that are saying that they can help you with the mental health research in retail. Speaking of which,
awesome.
If somebody wanted, to push an academic study of, like, say, just mental health in like retail, how do you go about doing that?
Yeah, great question. So typically you need money. So little known fact about professors who work at universities is that we don't get our salary paid by the university. I get half my salary paid by the university. I'm responsible for paying the other half of my salary through grants and through projects. At some universities, people have to pay their whole salary. So if I, get a grant and I then say I'm going to pay 10% of my salary or 20% of my salary to work on this grant. So getting a grant to support my time, to any supplies, support staff who are working on the projects, students who might be working on the project. There's lots of different mechanisms to get that money. There's federal funds. So NIOSH is the National Institute for Occupational Safety and Health. They award grants, and the National Institutes of Health award grants. CDC awards grants. They just take a really long time. And the rate of getting them is extremely low. They can be very hard to get, and it can take a year or two from the time you write the grant to actually getting money. So there's other like state grants. At the university, I often get money we have a labor center, so get money from them. And I also frequently partner with unions, as a way to kind of, we're mutually interested in a project. The project that, we've been talking about with the grocery stores was actually unfunded work. I had a graduate student who was really enthusiastic, and he took on, a lot of the labor. And so that's, also sometimes an option. If in COVID, it was very much like, I want to do something quick. I don't want to wait to get money. Like, we need to start doing this now. And so it was better to just kind of jump in and do it unpaid, as opposed to waiting a year and a half when it's no longer relevant.
Well, I applaud you for that. And you just blew my mind. I had no idea that, the teaching profession in college, was like that. That's wild that, basically you've got to pony up, the second half of your salary. Mm-hmm. And I'm not going to get on that soapbox, but that's why I think all educators should be paid more. So I just want to throw that out there. Oh. Especially doing work like that. I mean, that's an important study, and it was done for free, and that's amazing. I mean, that is, it says a lot about, like you said, your partner's, exuberance for wanting to get it done, and excitement for the study. Another question was, is there future research that we can all look forward to from you?
Yeah, so and I also want to just say the grad student who was helping me with this, Alan, his mom is actually a grocery store worker, and that's why I think he was so immediately he was like, this is what I want to do for my thesis project. Like, I really want to work with this population. So that's awesome. So at this point, I don't have much in the hopper specific to grocery retail workers. As I've mentioned, I would love to do more with that group of workers. I have connections to a union out here. And so I think, looking at mental health, looking at needs around stress, also looking at things like bullying and violence at work, harassment at work. I think is really of interest and a need, and something that I hope to pursue in the near future. In terms of, kind of the work that I'm actively working on, I'm still very much working with the U.S. Mariners, and, trying to think about how to, so we saw very high rates of depression, anxiety, stress, suicidal ideation, and PTSD in U.S. Mariners. And so it was, very apparent to everyone involved that, like, hey, we have to intervene. So kind of trying to work on what some of those interventions might look like. And then I'm still working with the women construction workers who have also had very impacted work the last couple of years, as many have. And we've developed a mentoring program that would basically be between like a journey level woman and an apprentice woman, to try to make sure that, they make it from the apprentice stage into the journey level, and they actually make it into a career in construction. And I think that mentorship is, something that could be powerful in other occupations as well.
Absolutely. Now, in Washington State, is that a pretty big union state?
So I learned today that Washington is the third largest, or the third union state. So, but we have Boeing. Boeing is unionized, so that's really big out here. But it's the third in terms of number of workers in a union in the country.
Wow. Like I said, I've got the chat's just blowing up, we'll volunteer, we'll volunteer, we'll volunteer. So,
great. Yeah. We'll have to give out my email address. I want to hear from everybody.
Be careful what you ask for. Because we can give you a lot. If that's something you're interested in doing, I can, yes, I will give them your email address and have them message you. Let's see, what else do we have question wise? There was a question, while you were doing these studies, did you ever witness them working on the ventilation system while you were there?
Oh gosh. No. But it probably wouldn't be in a place where I would even be able to see it. It would probably be in the back room or, somewhere. So I just cannot comment on the effectiveness of ventilation, except to say that most places could probably be doing better.
Correct.
Across the board.
Another question from across the pond from Irish Connection. He asked, do you know to what degree the infection rate was higher in retail, if any? So I guess from studies, I guess you could kind of piggyback off of, the grocery store thing. Mm-hmm. When you were going through the pandemic and you were going through these studies and whatnot, were you getting any kind of data showing what industries had like the highest?
Yeah, so we have some data on that, and you can imagine it's incomplete and probably an undercount, because some people might not, when you go, so at least here in Washington, and if you go to the doctor, the hospital, you are asked to share your industry and your occupation. Some people don't. Sometimes it doesn't get recorded accurately or at all, especially during hospital surges. And we also have, information on workers' compensation claims. Again, here in Washington, our workers' compensation is run by the state. And so, it's a kind of state data on who's putting in claims and who's getting them accepted, which of course, you recognize that some people aren't even going to put in the claim. But so what we've seen kind of from, and, just surveys of people, like, did you have COVID? What's your job? So kind of cobbling all those data sources together, it's not a surprise. Healthcare tends to be the hardest hit. But retail is in the top 3 kind of consistently, like food processing. So, slaughterhouses is high. Those who work in social services and protective services, firefighters, police officers, community healthcare providers, things like that are high. But retail is right up there.
You were talking with the EMTs, the mm-hmm. EMTs and the Uber drivers, man, you want to talk about like, sitting ducks for this mess.
Right.
And that is just really, really, when you think about the delivery drivers, especially because, restaurants, they jumped on this curbside, Uber and DoorDash and people like that saw this, gold mine. Oh, we're going to get some drivers and we're going to send them out there. It's like sending lambs to slaughter.
Mm-hmm. Yeah, well, and especially one of the things that really stuck with me from the Uber drivers is they said, they would say so many people would call us to drive them to the COVID testing site.
Ooh.
Like, oh gosh, imagine that. And, you get in the car and they're like, oh, drive me to the testing. It's like, oh gosh. Yeah. So in that population, there were very high rates of presumed COVID. It was like, this was done so early that testing was like hardly widespread. Yeah. Double digits easily.
So did you have any kind of data in the grocery stores that you were kind of looking at as far as like any employees that had passed away from COVID?
So not specifically in the grocery stores, but we did have a few fatalities of grocery store workers in our state in Seattle that were attributable to COVID-19. And it's interesting you bring this up because tomorrow is actually Workers' Memorial Day, which is a day where we, honor those who died at work, but kind of more largely think about how work affects people's health and whether it, people get injured at work or die at work or get sick at work and so, I think it's just really timely to think about that and kind of acknowledge the fact that for a large number of the population, work is not safe. And there are real consequences to work there can be, and that's a huge sacrifice.
It kind of mirrors something I was reading earlier. It's talking about societies and how with the pandemic, it's very similar to like the Victorian era when industrialization started really kicking off, that everything was so dangerous for workers. Mm-hmm. And here we are, as advanced as we are as a society, only to get kind of knocked back into that because it wasn't safe to go to work. Mm-hmm. And that's a very intriguing parallel, so it's a little sketchy. And the thing that when you talk about like the fatalities, I think the one thing that really irked me, being retail and working grocery and all this other stuff, is there was such a push during all this. You've got a team out there, you're doing this study, for the greater good, but at the same time, you've got these companies, having backdoor talks to, the Chamber of Commerce and all these other important people trying to shirk liability of any of that.
Right. And we saw how some companies made so much money during the pandemic, right? Like Amazon made so much money and, can barely provide hazard pay or, sick leave for their warehouse workers. So, yeah, it's a real... And I think like what we're starting to see now, I think, is that the power balance is starting to shift a little bit because it very much was, the employee had all the power. And now we're starting to see employers taking more power, both in terms of unionization, like Starbucks and Amazon, but also people who are quitting, saying like, screw this, I've had enough. And I recognize that not everybody is in a position to take advantage of those things, but I do feel like a wave is coming that might shift some of that power back to workers just because employers realize that workers aren't messing around anymore, that they expect to have good working conditions.
Yes. And you're 100% correct there. I think the one thing the industry fears the most was exposed by the pandemic is people started to become cognizant of their worth. And, you had a lot of these industries especially, anything customer service based, basically, dealing with people, you saw such a big hit, on, the quote unquote great resignation. Well, these companies weren't taking care of their employees, but, whether it be pay, mental health, just overall protections during the pandemic, those kind of things. And these people said, okay, we're not getting paid enough for this. You're not going to give us any more money. You're not helping our benefits. And hazard pay is a big one that you brought up. There was some like very superficial offerings there at the beginning that was basically all PR for the companies. Everybody got wise to it and said, that's it. Peace out. And yeah, you're correct. There is a movement. And the sad part is, up until about 3 months ago, that's all we were hearing about in the news was great resignation. And then all of a sudden it just dropped off. We don't hear about it anymore. It's still happening. But, when you look at big money and corporations and stuff like that, they're going to try their best to squash this stuff. And I'm still waiting to see some sort of set of lawsuits on different companies, that are trying to shirk their liabilities of taking care of these employees. And, family members are coming forward saying that, their mom or dad passed away due to COVID because there were no safety protocols in these different businesses. Yeah. And, you're dead on. I mean, it's happening and it should. And I really do applaud the fact, you brought up, the hazard pay, the extended benefits. One thing that really, I thought and was hopeful would change would be sick policies in places. Yeah. And it hasn't.
Yeah. Well, and it's interesting because some of the work we've been doing with EMTs has been digging into why people come to work sick. So that is there's actually an academic term for it. We call it presenteeism, which means you're coming to work when you shouldn't be. And whether that's because you're sick or because you're distracted or because you're injured or, you're not in a good headspace, it's not a good thing. But what I think is important to recognize is that if you have workers who are coming to work sick, then you as an employer have done something wrong. This is not the employee's fault. This is your fault. You're not providing them enough sick time. You're not providing them a way to easily find someone to cover their schedule. You're making them feel like if they don't come, they're going to get fired or they're going to get harassed. And so I think that is kind of another interesting thing of all this is that it used to be like going to work sick. People wore it as a badge, like, oh, I'm working through it. And now we realize we shouldn't be doing that. And our employers have been tricking us into thinking that we're doing a good thing by doing this. When in reality, it's like, I do consulting with a lot of different businesses and they often ask me like, what's the one thing I need to be looking out for? That would tell me I have a problem in my workplace. I'm like, if people are coming to work sick, you have created a problem, right there.
Yes.
That's like,
and you're right about wearing a badge. And, I'll be 52 this year. And, I came up through management and whatnot, and it was drilled in our head. It don't matter if you're sick, you got to be there, and that became a culture. And there are some people out there that, like you said, I've never missed a day of work. Well, good for you. You've probably made people sick. And then you add into it the divisiveness of the whole pandemic. Not only do you have people coming in sick, you have people coming in sick out of spite because they refuse to believe that they have what they may have. And it was just a recipe for disaster.
Yeah. Yeah. But if people felt like, oh, I have enough sick time and my boss isn't going to like harass me and I'm going to get paid, it might be easier to feel like, oh yeah, I can stay home because I have a cough, not like, oh, I have to save my precious sick time in case I get like, really injured or really sick or something. Yeah. I feel like it's a more complex issue than maybe we had thought about before the pandemic.
You are correct. And you're right. I mean, that is a problem. You as a corporation or a manager shouldn't want people in your building sick. And that speaks a lot to the leadership as well, even at a store level, because these store managers had the power to send people home. And in a lot of instances, they didn't. And they didn't because, well, yeah, they showed up, they're sick, but we really need that body here. So,
Right.
It's been encouraged for so long, but I'm glad to see that, a lot of people have called on to that. And now they'll just, if they've got to call in sick, they're going to call in sick. And that's the way to be. I mean, it's foolish, for me for 30 years, there were plenty of times I went to work that I had no business being there, but you felt like you were going to lose your job. Or like you said, get harassed, or your boss is going to be all over you and all this other stuff. But, I think that as far as sick time goes, there's got to be some sort of think tank out there somewhere that can kind of come up with a better plan, because a lot of people, I mean, face it too, during the pandemic were coming in sick because they couldn't lose the money. And if there was an actual fair and balanced sick plan, you just imagine the amount of spread that could have prevented, because we all know somebody who showed up to work that had it. So,
yeah. And I think employers will tell you, yeah, but then people will abuse it. But the way I push back on that is, well, what about these big tech companies where they get unlimited vacation and unlimited sick time? No one is assuming that they are going to abuse it. What's different? Why would you think that an engineer at Google wouldn't abuse it, but a grocery store worker would? Like, they won't abuse it. If people want to work. People are driven by wanting to work, and so I think I completely agree with you that people need more sick time, and it needs to be accessible without strings attached. And employers need to trust that their workers are going to use it when they're sick, not just because they don't want to work. People want to work.
Yeah. And it's the human thing to do. It's doing something good for the benefit of everybody. Like you said, look at how much money all these businesses have made the past 2 years. They can afford it, They can afford it. I mean, but they refuse to. And that's the thing, when you especially look at how much, because it's not completely over yet. And you look at like the inflation now, and look at how much these people are making. They're not getting raises to help combat, inflation. So now they've got that extra burden on them, and they've got no way out because, the sick pay is terrible. Some companies tell you get only X amount of days. They should at least have done something industry-wide that if you test positive, that there should have been like an extra tier or a different type of sick pay to ensure that they felt safe in staying home and not having to come to work. Just the PR alone would have done them good.
Yeah. And and what we also saw was just so variable by state and municipality. Some states it was like all essential workers get an extra 2 weeks of sick leave. And some states was like, you're on your own. And so also, it's also just contributing to inequities when it's not standardized across the employer. Like Walmart has stores all across the country, but what they were doing in one state might be different than what they were doing in another state.
Which makes no sense. It should all be uniform.
Which makes no sense.
And you're right. And it is kind of, there's great benefits for like these high dollar people, but the people that, had to be in everybody's face because they were quote unquote essential, they should have gotten the same treatment. And you're right. Those people, typically the people that work in the kind of industries we do, you're right. They want to work. They don't want to be out. But there are times that you wake up one day, you're like, I really, really don't feel like going to work. I'm really, really sick. And you do it anyway. And call it for what it is. It should be a benefit, And like anything else, people are going to abuse anything. I mean, there's people out there that will do that, but that doesn't mean that you shouldn't offer it.
Right.
Now, have you seen any changes in like the sick pay and stuff like that for like the EMT field?
So there was so the EMTs, they were previously, if they took more than 96 hours, I think, within a year period, they were basically put on probation, which meant that they didn't get the best routes and the best schedules. And, it's like any minor infraction, they could lose their job. And so it sounds like they suspended that during the pandemic. Like you could take more sick leave without getting put on the warning list, basically. So that's something I remember hearing about. And I think they made it so, but they were facing really just shortages of drivers. So it was, and if someone was sick, they would just not have as many EMTs available. So it has effects on the community. And, it takes longer to get an ambulance. But yeah, they did drop some of the limits on sick leave that you could take before you get on probation.
Going back to the mariners, you made the point being isolated on a vessel. Mm-hmm. And like you said, only so many have like internet communication.
Yeah.
I know a lot of what we go through, the mental health aspect of it sucks for us dealing with customers, but I cannot imagine getting stuck on a boat. I'm not allowed to come back to shore. The world right. seemingly falling apart. That have to do a number on those folks.
You can't hear from your family. You don't know. Yeah, it's a job that requires a high level of mental fitness to even get your credential from the Coast Guard. And so I think that was why, so the folks I was working with in the federal government, I meant the Department of Transportation. They were pretty surprised by the 20% of folks who likely have depression, because it's like, this is a profession that you should be very mentally fit in order to enter. And we're seeing these fairly high rates. And there's concerns about if they get help for mental health, that they will lose their U.S. Coast Guard credential and not be able to sail. So yes, it's extremely, it's just kind of it's the same as people who work, maybe in long haul trucking or on oil rigs, or even, similar to people who are deployed. I'm not trying to compare the two because I know folks who are deployed for the military, it's not just the isolation, but it's also what, the work they're doing. But yeah, that isolation. And then to learn that only about half of people have contact with their family. It's just, gosh, and you're supposed to get off the boat after a month and you're not allowed to. And so it's another month and it's another month with no end in sight. Just challenging.
So especially with that one, how does a study like that and the results that you're getting and the feedback affect you? That sounds like something that if you really got into that kind of stuff would keep you up at night.
Yeah, having worked with a variety of occupations, I've learned so much about work. And what I always find is, even with the mariners, hearing all these things, we always do this series of job satisfaction questions, which is a scale. It's been around for a long time, but it's basically like, do you like your job? Do you like the people you work with? Do you think that the work you're doing is valued by society? And for the mariners, over 95% of respondents are like, I love my job. I'm doing important work. I like who I work with, and so I think, and some of it is like, I, as an outsider, I'm like, gosh, this sounds horrible. I'm stuck on this ship with all these with these people and I can't get off of it. But I'm like, no, these people love their job. And so to me, it really kind of just drives me to like, these are people who love their job and are performing an important service for all of us. So then I owe it to them to try to make their job, the aspects of their job that they don't like, to try to make it better for them. Someone has to do that work, and it is important work. And they love doing it. So, and I'm sure if I were to tell them about my job, and probably you all as well, you're like, your job sounds horrible. So, it's often, so yeah, I mean, hearing stories, and some of the stories I hear from women working on construction sites, it's very, yeah, I have a 6-year-old who's stomping around upstairs. I'm sorry.
Oh, you're fine.
If you hear that. So hearing stories from women in construction who, have had horrible things happen to them. Like, yes, it's tough. It's tough to think that there are folks who are going to work every day and experiencing those things. But I guess I find peace and solace in the fact that, these are folks who like their job, and I have the skills to try to help improve the aspects that are not so great, or at least to determine what they are and raise awareness around them.
Like I said, I cannot commend you enough for your work. And I find conversations like this absolutely fascinating, because there's so many, nuances to these different things. And at the end of the day, whether it's a mariner, an EMT, an Uber driver, or whatnot, we're all in the same boat. We all have jobs, we all have, things we need to take care of. And, our work life is paramount, to a lot of things. And one of the biggest things that it affects, as is our health. And, and having said that, we're just about at an hour, and I've got a question here, and I want to end it out on this because I think this is a great one. This is from JB Gatewood. It says, so I'm curious what steps retail workers could take to lobby employers for sick day reform. The problem isn't a lack of solutions, it's a lack of compassion.
Oh, gosh. I think strength in numbers is very important. And anytime you can have multiple voices demanding the same things, I think often we look for change to come from the federal level. And that's just not going to happen. No matter who's elected president, no matter who's in the Senate, OSHA is not going to update their standards. But something that I've seen as being successful is municipalities often have a lot of power to go in and make changes without having to have a vote and so city council members often they could, so writing letters to the city council, I've seen, so that one of the EMTs I worked with wrote letters to the city council about some changes in the workplace that she was not enthusiastic about. And, she was able to have an audience with them and explain her feelings. And that's how we've also seen Uber drivers here in Seattle have gotten a lot of benefits. Like they get paid for the time in between rides. They get paid for the time they spend cleaning their car because of work with the city council. So sometimes when it feels like OSHA doesn't care about me, they're never going to do anything, federal government is gridlocked, nothing's going to change, sometimes the change might just have to come from a very smaller level, like the city that you live in or your county or even your state. And I do think strength in numbers is important. Also, unfortunately, and I wish this wasn't the case, but painting things in economic terms instead of health terms. Right. Compassion doesn't sell groceries, right? But if you can make an economic case for, this many people, because they've come to work sick, they've spread the disease to this many other workers. And so now all these workers have been out, where if just the one worker had stayed out and was paid to do so, you would have saved, so I wish that health was enough of a driver, but sometimes economics is actually what speaks. And so coming up with that case, and reaching out to unions that represent workers similar to you, if you're not unionized, they often, have resources as they try to expand their footprint as well.
Great answer.
Maybe not satisfying or helpful, but I feel, yeah.
Well, I mean, you just, we all know it. It's wealth before health. And you're right. You have to turn it into a bottom line, economic thing for them to even raise an eyebrow and listen. So, but
I mean, if you're feeling really brave, you could all walk out. Nobody shows up to work one day. I mean, that sends a very strong message, but I understand that the fear of retaliation is also quite strong.
Yeah. And then that poor store manager is going to be there working by themselves.
Yeah. That's got to get them to come with you.
Yeah, exactly. Lock the door and go home. So, Marissa, thank you so much for being here. I really have been looking forward to this, and I really enjoyed this. What I will do is, for everybody in the chat, that if you're interested in communicating with her about mental health and whatnot in our business, DM me on Twitter or send me an email, and then I will hit you up with her email address, and you guys can take it from there. It is one of those deals where free info is always good, and every little bit helps, and it helps the cause. So, Marissa, thank you so much. I really do. What time is it there now?
It's 6:00. So early.
Yeah, early. It's getting late for us. We're sitting at 9 p.m. So, you have fun with your 6-year-old, and I will be in touch. Keep me posted on like different stuff that you're doing. If you've got something like another study, and like I said, we're branching out. It doesn't have to be retail. I've got some people, advertising coming up. I'm trying to get some film people. It really is, the retail war zone's the name, but I really want to cover a whole lot more, and any kind of industry. So anything you come up with. I
actually do a lot of work with the TV industry too. So I'll definitely DM you.
Oh, yes. DM me about that because I've got friends in the entertainment industry that I need to reach out to as well. So that would be excellent. And the chat is thanking you immensely for being here. JB Gatewood said, thanks for the great answer to the last question. So having said that, guys, thank you once again for being the best community on Twitter. Thank you, Marissa, for taking the time to speak with us. I'll get some information to you and have some people shoot you some emails. I want you to have a very wonderful rest of your day. Stay safe and keep dodging it.
Yes, you all as well. Thank you for having me.
All right. Thank you, everybody. We'll see you next time.
Bye-bye.